Welcome back. Today we're talking about something that could save your life: colon cancer. Colon cancer rates are rising, especially in people in their 30s and 40s. Early detection is crucial. When caught early, colon cancer is highly treatable. It usually starts as small, harmless polyps in the colon that can turn cancerous over time, which is why screening matters. If you're not at screening age, knowing the warning signs is your best defense. Let's break down the key symptoms you can't afford to ignore. Have you ever stopped to think about what your bathroom habits might be telling you about your health? It's easy to overlook, but sometimes, the first signs that something's wrong with your body show up in the most routine places, like your daily trip to the bathroom. One of the earliest and most important clues can be changes in your bowel habits. These changes might seem minor at first, but they can be your body's way of waving a red flag. If you notice your usual routine suddenly shifts, maybe you're experiencing constipation, diarrhea, or even alternating between the two, and these changes last for more than a few days, it's time to pay close attention. When these symptoms persist for weeks, it's not just a fluke or a result of a stressful week. It could be your body's way of telling you something more serious is going on. Persistent constipation, for example, can sometimes mean there's a physical blockage in your colon, such as a tumor that's making it difficult for stool to pass through. This isn't something to ignore, especially if it's a new problem for you. On the other hand, ongoing diarrhea might signal that the lining of your colon is irritated, possibly by a tumor or another underlying issue. Chronic irritation can disrupt your digestive system's normal rhythm and should never be brushed off. Another warning sign is the appearance of pencil-thin stools. This unusual shape can suggest that something is narrowing the passage inside your colon, often due to a blockage. If you notice this change, it's important to take it seriously. It's tempting to blame these changes on stress, a new diet, or a busy lifestyle. But if these symptoms stick around, don't just brush them off or hope they'll go away on their own. Your digestive system thrives on routine. When that routine is disrupted and the changes don't resolve, it's a clear signal that you should reach out to your doctor. Early conversations can lead to early answers. Remember, it's not about having one off day or a single unusual bathroom visit. What matters is noticing a new, ongoing pattern that's different from your normal. Your body is always sending you signals, sometimes subtle, sometimes loud. Listening to those signals and acting on them can make a real difference in your health. Don't try to self-diagnose or ignore persistent changes. Instead, seek professional advice. Your doctor can help you figure out what's going on and guide you toward the right next steps. Remember, early action can make all the difference. Trust your instincts, listen to your body, and don't hesitate to get the help you need. Your health is worth it. Unexplained weight loss might sound like a dream come true, especially in a world where so many people are trying to shed extra pounds. But when the pounds start dropping off without any changes to your diet or exercise routine, it's not something to celebrate. In fact, it can be a serious warning sign that your body is trying to tell you something important. While it's easy to brush off sudden weight loss as a lucky break, doctors know it can signal a hidden health problem. If you're losing weight without trying, it's time to pay attention. Medical experts say that losing 5% or more of your body weight over 6 to 12 months without making any effort is a red flag. For example, if you weigh 160 pounds and lose 8 pounds or more without trying, that's a sign you shouldn't ignore. Colon cancer is one of the conditions that can cause this kind of weight loss. The cancer can steal nutrients from your body, making it harder for you to absorb what you need from food. It can also disrupt your digestion and trigger inflammation, which speeds up your metabolism and causes you to burn through calories faster than normal. What's tricky is that you might not even notice a big change in your appetite. You could be eating the same as always, but your body is quietly losing both fat and muscle. This can leave you feeling weaker, more tired, or just not quite yourself. Often, unexplained weight loss means the cancer is more advanced, and that's why it's so important to catch it early. The sooner you notice and act, the better your chances of getting the right treatment. If you find your clothes are suddenly getting looser, or you're tightening your belt more than usual, and you can't explain why, Don't just assume it's a fluke. These subtle changes can be your body's way of waving a red flag. Unexplained weight loss is your body's alarm bell. It's a signal that something deeper could be going on, and it's not something to ignore or put off for later. If you notice the numbers on the scale dropping for no clear reason, make an appointment with your doctor. Getting checked out early can make all the difference for your health and peace of mind. Discovering blood in your stool or noticing it on toilet paper can be alarming, and it's important to understand that this is never something to ignore. Even if it seems like a small amount, or if it only happens once, blood in your stool is a sign that something in your digestive system needs attention. Many people feel embarrassed or anxious about discussing this symptom, but addressing it early can make a significant difference in your health. There are several possible causes for rectal bleeding. Hemorrhoids and anal fissures are among the most common, especially if you notice bright red blood after a bowel movement. These conditions are usually benign, but they can still cause discomfort and should be treated by a healthcare professional. However, it's crucial to remember that more serious conditions, such as colon polyps or colon cancer, can also cause bleeding. When a tumor is present in the colon or rectum, it can bleed as stool passes by, resulting in blood that may appear as bright red streaks on the stool, or blood that is mixed in with the stool itself. Sometimes the bleeding can be so subtle that it's only detected through special tests. The color and appearance of the blood can provide clues about where the bleeding is coming from. Bright red blood often suggests the source is close to the rectum or anus, while darker or maroon blood may indicate bleeding higher up in the colon. Regardless of the color, any blood should be taken seriously. It's easy to assume that blood in your stool is just hemorrhoids, especially if you have a history of them. But making assumptions can be risky, as more serious conditions can present with similar symptoms. The only way to know for sure what's causing the bleeding is to see a doctor. Your healthcare provider may recommend a colonoscopy or other diagnostic tests to identify the source and rule out serious conditions like cancer or inflammatory bowel disease. Even if you notice just a small spot of blood, or if it happens only once, it's important to get checked out. Self-diagnosing or ignoring the symptom can delay treatment and potentially allow a serious condition to progress. Early evaluation and diagnosis can make all the difference. Many causes of rectal bleeding are treatable, and catching a problem early can save your life. Don't take chances with your health. Always let a medical professional determine what's going on, and never hesitate to seek help if you notice blood in your stool. Black Tarry stools, known as melena, signal bleeding higher up in your digestive tract. Blood turns black as it's digested, so this is a serious sign. While ulcers and certain medications can cause black stool colon cancer, especially on the right side, can too. The key difference: melena is sticky, foul-smelling, and tar-like. If you haven't eaten foods or taken meds that cause black stool, and especially if you feel weak or dizzy, seek help immediately. This could be a medical emergency. Don't wait and see. Get checked right away. Sometimes colon cancer's only clue is iron deficiency anemia found on a blood test. A tumor can cause slow, hidden bleeding, gradually depleting your iron stores. Symptoms include fatigue, weakness, shortness of breath, and pale skin. In men and postmenopausal women, new iron deficiency anemia is a major red flag. Doctors will investigate for hidden bleeding, often starting with a colonoscopy. Don't just blame tiredness on stress or age. If you're persistently exhausted, ask for a blood test. If anemia is found, ruling out colon cancer is critical. Don't ignore unexplained fatigue. Ever feel like you still need to go, even after a bowel movement? That's called tenesmus. In colon cancer, a tumor in the rectum can trigger this constant urge by pressing on nerves. You might strain, feel pressure, or experience cramping, but nothing comes out. This symptom is disruptive and shouldn't be ignored. While other conditions can cause tenesmus, a new persistent urge needs investigation. A rectal exam and colonoscopy can quickly rule out cancer. Don't wait for it to go away on its own. Talk to your doctor if this feeling persists. Occasional bloating and gas are normal, but persistent, unexplained bloating and cramping are not. A tumor can partially block the colon, trapping gas and stool, and causing pressure and pain. You might notice pain after eating or a constant sense of fullness. Changes in gut bacteria from a tumor can also increase gas and discomfort. If bloating and gas become your new normal for weeks, don't just reach for gas relief meds, especially if you have other symptoms. Get checked. Persistent changes are your body's warning. Don't ignore them. Here's the most dangerous symptom. No symptoms at all. Early colon cancer often causes no pain, no bleeding, and no changes in your health. Polyps and early cancers grow silently for years. That's why screening is so powerful. It finds problems before you feel anything. Colonoscopies can remove polyps before they turn cancerous. Don't wait for symptoms. By then, cancer may be advanced. Screening is recommended starting at age 45, or earlier if you have risk factors. The absence of symptoms doesn't mean you're in the clear. The best time to act is when you feel fine. Screening saves lives. The most important takeaway? Take action. Recognize the warning signs, but don't wait for them. Screening is your best defense. Talk to your doctor about when to start screening, especially if you have risk factors. Don't put it off. Early detection is everything. Share this video with loved ones. Your action could save a life. Subscribe for more on prevention and health tips. Thank you for watching, and take care of yourself. Stay safe and be well.